love working with teenagers and building a relationship with them and working with them on navigating substances and how to build up coping skills in order to help keep them safe and healthy.
It allows us to change teenagers' trajectories in their lives. We get to meet them so young and get to teach them about how substances affect their daily life, but also how it affects how their brain develops and affects the rest of their future.
It's been an amazing experience getting to work on multidisciplinary teams, and I implore anyone who takes care of young people in the clinical or non-clinical setting to learn as much about substance use in this patient population as can have such a positive outcome on the health and well-being of our adolescent population.
It allows me to take care of very marginalized and stigmatized people. Like many of you, my own family has been touched by addiction, and the opportunity to care for folks who struggle with substance use disorders is of deep personal significance to me. And it's fun.
One of the most special things to me about being an addiction medicine provider is the role that we get to bring with curiosity and how it can become a tool for compassion when we get to walk with people on their complex journey in substance use care.
Number one is the patient stories. So in addiction medicine, we get to help people at their darkest and lowest points, and we get to follow them over time and see them get better. As a primary care doctor, my clinic's full of patients who've been surviving and thriving despite their substance use for several years.
I learned so much from the patients, and that was probably the most surprising thing to me. Was we would talk to them and they would teach us about how they did wound care. They would teach us about how they use substances and why, and the different times of day they would use different substances. And so I just felt like I learned so much, and it was just really a great experience so far. So I'm excited for more.
What is fascinating is how interested I am in continuing to work in this area and to help the treatment of addiction join the mainstream of healthcare so that it's no longer treated over there and by other people, but it's part of medicine. It's part of what all doctors do.